Function with Purpose Podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 10, Episode 7 of the Function with Purpose podcast. This is Dr. Amy here today with you. Thank you for joining in again. Also, quick reminder, these podcast episodes are reposted to the Fortress Physical Therapy YouTube channel. I will provide the link to the YouTube channel. There's some cool content on there. FPT Coffee Talks, of course, the podcast, some shorts videos of me demonstrating the use of the kettlebell and how one can incorporate that into their recovery protocol, strengthening protocol, etc. So yeah, go ahead and give me a follow on there. I'll provide the link below. And thanks for tuning in. All right. So I love this topic today. And of course, as with most of these podcasts, I'd like to share some stories that happen regarding some titles I've been coming up with. So, today is Be Your Own Advocate. Be your own advocate when it comes to your health, wellness, fitness, and recovery. Especially your health. So, a big thing pops in my mind as, I guess, learning to advocate for the self when it comes to, like our parents. Yeah. So, my mom's in her mid-70s and, lived in West Virginia the majority of pretty much her whole life. And when she would have to visit the medical doctor for like her checkup, or maybe she had to get a scheduled yearly mammogram or like a colonoscopy. Fortunately enough, the medical system back in West Virginia, I lived in a small community, that they would contact her and, kind of be like, oh yeah, you gotta schedule your mammogram. Oh, okay. All right, cool. But, things have advanced, and I think after going through the pandemic that the world and the medical system have kind of flipped the script. And I actually kind of like it, because we shouldn't rely on others when it comes to our own health, wellness, fitness, and recovery. You have to rely on yourself, because it's up to you to take care of yourself. So be your own advocate. So it's one of these things that I think we need to be more when it comes to our health metrics, like our basics of like blood pressure, glucose, heart rate, our vision, teeth cleaning, haircut, exercise routine, so like getting a gym membership or something, that you, the person, the patient, needs to be in charge of you, right? Duh. So I'll kind of explain this medical system. So when it comes down to it, what do you think the main reason hospitals are kind of popped up everywhere? I'm talking hospital, like our big major hospitals, right? So a huge medical system. So for example, here in Charlotte, we have Atrium Health, Novant Health, And then some extensions from those, or a little bit smaller clinics in the Charlotte area, like Ortho Carolina, clearly that's orthopedics, is another company, and or a medical system. But, what are medical systems there for, right? And even like little, only strict emergency care systems that are little hospitals that are popped up here now, like it's only for emergencies. Or urgent care, right? So what are these medical systems here for? I just said it. Emergencies. Medical hospitals, medical systems are here for us, the people, when we become very, very, very sick. All right? Very sick. And all the way from elective surgery. So, i.e., I don't know, something that kind of pops up on my head, like plastic surgery, like a breast enhancement. I don't know why I thought of that, but I just thought about that. Like a breast enhancement, right? Like that's a medical system. It's a specific medical system. It's an elective surgery, not a emergency surgery, right? Usually. So when we have this mindset of, oh, well, yeah, I'll go see someone or schedule something when, something pops up in my body or on my body, or I feel a little weird. I'll just reach out then. I think especially after going through a pandemic that the whole world experienced, that we need to significantly flip that script. We need to be more preventative. We need to be more advocating for ourselves, that we have to instill these scheduled routines, scheduled practices to advocate for our health, our wellness, our fitness, and our recovery. Because I don't know about you, I don't want to be entering that medical hospital system. I don't want to become very, 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 very sick. So you have to advocate to prevent that. So going back to my mom's story, so, grew up in West Virginia her whole life, and, the medical system was small back there, so they had people that actually called you, and you were actually talking to a person on the phone, and it was like, hey, you got to schedule your annual physical. When do you want to come in? Oh, okay, cool. Well, now it's a little different, right? Everything is at our fingertips. So my mom's mindset is, oh, well, hey, Amy, do you think I need to go in for my annual physical and then maybe get a mammogram this year? I'm like, well, number one, I'm not your doctor. Number two, what do you think? Number three, when was the last time you had a mammogram? Oh, it's been 3 or 4 years. Well, Mom, now this is just me talking. You had a history of breast cancer. What do you think? Oh, yeah, protocol is if you, are in remission, you're cured, breast cancer, you typically don't have to get a mammogram every year. There's a specific threshold one has to cross, and it's usually like every 3 to 5 years after you're in remission that it's recommended to get a mammogram every 3 years. But anywho, I'm not a medical doctor. I'm not giving people advice. But yeah, mom was like, yeah, it's been like 3 years since my last mammogram. And I'm like, I look at her, I'm like, it's probably time to get one. She's like, well, I just don't know. I'm just going to wait for them to ask. Wait for, the healthcare system to call me. And I look at her and I kind of tilt my head. I'm like, do you really think that's going to happen? Well, that's what they did back in West Virginia. I'm like, no. Does not happen down here. You need to physically call the place to get your mammogram and schedule it. Put it on your schedule. Oh, I do? Yes, Mom. It's called advocating for your health. And you have a history of cancer. We just have to be more preventative. Okay. Oh, okay. Yeah, I understand now. All right. So, I think this also goes around too that, not waiting for unexpected events to happen. So trying to teach and help my mom to be her own advocate, that if she has like a premonition and was like, you know what, I'm due for a mammogram, I need to get one. Okay, well, schedule it. Maybe you do need to call your physician and be like, hey, where do you send patients to get their mammogram? Because this will be my first mammogram here since living in Charlotte. Okay, go here. Here's their number. Okay, cool. Awesome. I will call them. Right? You can't rely on the medical system to do the things for you. Right? Because what is the medical system there for? They're there for us, for the people who become very, 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 very sick, right? They are equipped to take that on. But we want to not become very, very, very sick, right? So we need to be less reactive and more proactive. We need to advocate for ourselves. So that's what you do. You call perhaps a primary care physician, say, hey, I am due for my physical. I was waiting for you guys to give me a call or give me some insight when I was due, but I actually checked my calendar and I'm due. I want to set up an appointment. Okay, good. Because guess what? In Charlotte, in the county that we live in right now, there are over 1.2 million people that live in this county in Charlotte. Do you really think the medical system touches on every 1.3 person to be like, hey, it's your annual physical time, you better get on the schedule? Hell to the no. So, the more you wait, if something might be popped up, right? If you're waiting for something unexpectedly to pop up, you're like, oh, well, I'll wait until something happens or it gets a little worse. The more your snowball can get bigger, right? The more big the snowball gets, on the flip side, if there's something is super serious going on, guess what? It will take that much longer, probably 2 to 3 times as much, to recover from. The medical system, in turn, using the prime example here, 1.3 million people that live in the county that I live in Charlotte and the surrounding area, they are not going to have, not even an automated system to call a number to tell people that, hey, it's time for your annual physical. Please call this number back. We want to make sure you're all healthy. What? Do you really think that? So we always have to be advocating for ourselves. We always have to be that much more ahead of the game. And when it comes when it comes to physiotherapy, it's funny because it always happens. I will have a potential patient, or I hear that I might have a potential patient from a current patient. They're like, yeah, I'm talking to this patient that I see every 6-8 weeks, and she comes to the gym. She's walking on the treadmill. We usually chit-chat real quick. She's like, yeah, I'm trying to get my fellow partner here who does the workout with me every day in class. He keeps complaining about his knees and this, that, and the other, and he's trying to do all of the recovery on his own and YouTubing and all this. And I advise him, I'm like, listen, maybe you just need another pair of eyes. Just walk in. Just reach out to Dr. Amy. Or, well, I mean, I'm there, so I'm using this as an example. Reach out to Dr. Amy. See if she can notice anything. Maybe there is something that you're missing. Because you're seeing another healthcare provider, and he basically said, you know what, like, you're doing all the recovery things. Maybe it's time to get just a different pair of eyes on what's going on. And my patient, her buddy's just like, well, my knees are actually feeling pretty good. I've been doing some backwards walking, and, the knees are actually kind of making a slight turn around the corner. And she just kind of looks at him sideways and was like, So, she's like, you need to advocate for yourself, man. Like, sometimes we just need to let the wall fall down and have someone else look at it. Take the pride patch off your chest and just see what's up. And it's funny. It's just funny how she tells the story. But, man, it's, I get that a lot. Like, as a clinician, as a physiotherapist, I will have people that walk past me in the gym, and, even when I'm working out and I'm finishing up my workout in the morning, someone will still come up to me and be like, hey, I need some advice. What do you think? I have this thing that's going on in my neck, and occasionally some stuff that kind of like will roll down to the side of my arm into my elbow. What do you think it is? And I'm like, well, sounds like you need an assessment. Here's my number. Like, how flexible is your schedule? Right? And then, oh, well, I don't know. Maybe I'll just go to the ortho. I'm like, but I'm thinking, you're not being your own advocate. Like, I don't think it's something that's that serious if you're already asking me that question. Because if it was something that was that serious, i.e. entering the medical system, then that tells me you're super sick or something super serious is going on. So being your own advocate, just getting a pair of eyes on things or scheduling something to prevent a snowball that happens in the future. Your future self is going to thank you now if you do something now, and if you advocate for yourself now rather than later. So that is a big thing that still happens from the physical therapy perspective. And even from my mom's perspective, right? Like, she's like, oh, I just don't know, I feel like the office should I'm like, no. The medical office will not contact you. Do you realize that? You need to proactivate yourself to advocate getting things scheduled. Just like you do your haircut. You schedule out 3 months in advance. No different. So I think when it comes to prevention purposes, especially when it comes to our health, some big things like, I have a family history of heart disease, cancer, high blood pressure, cholesterol, what else? Yeah, cancer and heart disease is the main one. So what do? I know that every year I want to get a physical. I'll get a blood cell panel. So I'll get blood drawn, blood work, just to make sure things are okay. And that's okay, right? Like, I become aware of these numbers. And again, blood work is just a picture in time at that moment, right? So I do that. Every year, I get my eyes assessed. I go to the optometrist, make sure my vision's fine, but I'm prone to actually some eyelid styes that happen once a year, once every year and a half. So I have to advocate to schedule and be more proactive with that and do some eyelid cleaning upon my own too, right? To prevent things from happening, right? I get my teeth cleaned every 6 months. So I know that, every June, July, or December, January, I got to go in and get my teeth cleaned. It's no different. It's literally no different when it comes to physiotherapy, right? Physiotherapy too, if you're advocating for your health, wellness, fitness, and recovery, physiotherapy can be a prevention type approach. And that is one thing as a clinician that is still complete mind blown for me. And the public is very unaware that physiotherapy can be kind of like a prevention type medical approach, right? For those who own their own small business practice, we're not a part of that medical system. We're not a part of the sickness system, which we need, right? Because the human body will experience sickness from time to time, or something that might be a little bit more serious, right? So the medical system or hospitals have to be there, but then it's people like us, people like standalone, private-owned physiotherapy clinics, and even private-owned primary care clinics that should be on that flip side to prevent people from entering the medical system. So from the patient perspective, you have to be proactive and advocate for yourself, to care for yourself, right? So it's all about being less reactive. We need to be less reactive to things, because the more that we are less reactive, the more that we will not have to dig ourselves out of a deep hole, right? I want to be as ahead of the game as possible, so that way when I do have a setback, my ability to recover isn't as long. Like, I know what to do. I know who to reach out to because I have a healthcare team in place. If my tissues, joints, and body feels a little beat up or something, I might go to my bodywork therapist, right? Well, guess what? I have my scheduled bodywork therapy session every month. I schedule that out. I schedule that 3 months in advance. I schedule some chiropractic treatment every month in advance. I will seek out some physiotherapy treatment, some manual therapy work, probably every other month. Sometimes you can't just work on your backside, right? You need some help from someone else, and you trust that person to help you out. They give you what you need because you guys are on the same level, right? So being your own advocate, I think in my eyes, definitely is number one, advocating for yourself to make sure your health metrics are in place or are where they need to be, so you do not have to enter the medical system. And what is the medical system there for? They're there to take on risk, at-risk sickness, right? To help those who are sick in order to get them back to where they need to be and live their life. But, side note, if you really dig deep to medical systems, it's really messed up, because from the PT perspective, we talk a lot about how, a medical system is actually a business, and they're there to make money too. But that's a whole nother topic. But it's like, okay, which medical system's best? But anyhow, for this purpose, the medical system is in place in order to be reactive to when shit hits the fan, when something super serious happens. to your health, to your wellness, right? So being your own advocate by being more proactive, preventative, thinking ahead, so that way you do not have to enter the medical system. And that is where it's at. Having a healthcare team of people to help advocate for you indirectly too, that you're in charge. You are in charge of your health and wellness, fitness and recovery. You are in charge. And that's one thing that I have to constantly preach to my mom. I'm like, listen, you're in charge. If you feel like you need a mammogram, go get a mammogram. Guess what? Your colonoscopy, you got to get one every 3 years because you're prone to polyps. And we have a history of colon cancer in our family. In fact, Grandma, her mom, passed from colon cancer and some heart issues. So super important for Mom to be on top of that. Right? And don't let things wait and snowball and build up. You got to stay ahead of the game as much as possible. And it's no different. It's no different than when you're seeking physiotherapy services, right? Have that prevention approach. Have that building more robust approach. Advocate for your health, wellness, fitness, and recovery. Have your healthcare team of people so that the medical system is in the long distance. It's way behind you, right? It's way back there. I can't even see it because I'm so far away and ahead of the game that I'm feeling great. So be your own advocate. Schedule your own stuff. Exercise, eat well, get some sleep, manage your stress, water intake, fuel your body. Be your own advocate. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.